gotta turn my car on, let everything warm up. Man, last night was chill. Even though we had the same amount of people as the night before, I was covering more floors. But I had like 2 less patients. I think yesterday I had 21, today I had 19 when I started off. So I had 2 less patients, but I still was covering more floors. And that can be good and bad because you got less patients, but when you're covering more floors, I was covering like a total of like eight floors. 8 floors, like eight floors. And anytime you hear like a rapid response or a code blue on those floors, you got to go to it. So that's 8 chances. I'm 8 chances likely that whenever that thing is called, I got to go. It's going to be me. Now, the less floors you have, let's say you got 3 floors, you got 3 areas, but you got a whole lot of patients. That's bad because you got a whole lot of patients, but you only got 3 areas. So once you hear that rapid response on this floor, you know the likelihood of it being you is not that high because you only got 3 floors. So I had more floors, and I got a rapid response. The rapid response was called mostly because this is typical, man. Nurses getting the patient too much pain meds, bro. So now you gotta so it's kind of like a drug overdose, which is what it is. You gotta get Narcan. We gotta wake the patient back up so they can go in and get back up and see what's going on. And that's what took place. And then to begin the shift, everybody be like, everybody think that their patient is like most important. But it's like, I got a list full of patients that I gotta go and see. Like a sheet full of patients I gotta go and see. So I'm like, I'm not really putting no patients above anybody. I'm just starting off the treatments that's due at 8 o'clock and 10 o'clock. So if I got a floor that got a whole bunch of 8 o'clocks to do, I'm gonna do that floor first, even though there's some 10 o'clocks in there. So I'm not gonna do all these 8s, skip that 10, go to this floor, come back for this 10. No, I'm gonna do all those 8s, then I'm gonna do that 10, I'm gonna go to the next floor that got 8 and 10 like that. Just so I can keep like a smooth, so I can keep a smooth transition as I'm going through my floors. That's the way I work best. Now you're gonna become a therapist, you're already a therapist, and you do what works best for you and your work routine. But I'm not finna go, that worked best for me. So as I'm doing that, I get a phone call from somebody saying, I got a patient over here that's they're down and non-rebreathing, now their sats are low. Can you come give them a treatment? They got COPD. Alright, cool. Whenever somebody call me saying something going on, and you seem like it's serious, I want to ask you some serious questions. Okay, what's the patient's saturation? Oh, I don't know right now. But so this can't be too serious. If you don't know, you ain't go check. You just saying something. Obviously, you ain't go check because you just saying something. All right, no problem. I got a lot of people calling me saying that they patient need a treatment. So you got to just bear with me. I'll be there as soon as I can. They're like, all right, no problem. Just come as soon as you can. I'll be there as soon as I can. I just said that. Cool. 3 minutes later, I get a text. Because now they got these phones where like you're using iPhones to work with, so you can get text messages, phone calls, photo messages, all kind of stuff. So I got a text message saying, patient was sat 79%. Now they're on non-rebreather. Can you please come check them out? Alright, people sell wolf tickets, but you gotta go and see this stuff because you don't want it to be something serious and you didn't go check on it. So I get there. The patient is in like a lot of distress. I'm like, okay. But first I get to the floor. They saying, I see the nurse that called me. Like, hey, what's going on? She's like, well, the patient was sat at 79 on 4 liters, so I put them on a non-rebreather. Now they're sat at 100% and they have COPD. Okay, cool. When you need 100, you need 100. I'm like, all right. So as we go along, we got to just like wean the patient down slowly but surely because we don't want to have them on too much oxygen. Anything above 50%, the patient got to be transferred to like another unit, like with more observation, like a step down unit, or even the unit. And then the charge nurse came behind me saying, came into the conversation saying, oh yeah, we're aware of that. Can you just get a patient to treatment? Let's see how she does and we'll start to wean her down. I'm like, I get a treatment, but like I said, man, we can't sound enough. I'm gonna put them on like venti mask, see how we do. The nurse was saying, I got them on 8 liters. But are they still wanting a non-rebreather? She was like, yes, that's still 100%. But if you don't know this equipment, bro, you don't know. If you on 100% oxygen and it's on 8 or 9 liters, it's still 100% oxygen. And some of y'all may be saying, well, to have a non-rebreather mask on 9 liters or 8 liters, that's too low of a flow. That's incorrect. Now let me know if I'm being incorrect. The flow doesn't matter. The flow needed for the non-rebreather mask is enough so that when a patient inhales with the mask on, the bag doesn't deflate on the non-rebreather. That's the correct answer. That was on the state board exam. I'll never forget that. I'm like, what the hell is supposed to be like flush? No. You inflate you turn the flow up until the bag on the non-rebreather mask doesn't deflate when the patient takes a breath in. So hey, it can be on 8 or 9, it's still getting 100. So I go in the patient room, the patient in there like doing like so I'm like, all right, that don't really look too good. But let me get his treatment, let me see how it goes. That could really help open the patient up. Patient was a little bit tight. Gave the treatment, patient doing fine. Everything, patient like, yeah, I feel a lot better, I'm doing a lot better. The breathing was still like, it was still deep, but it was more controlled. It wasn't like a labored breathing. And I wasn't biggity bouncing. I was just, I'm just being thankful for, I'm just being thankful for life. You feel me? Like, feel good to be alive. I can breathe again. Like that kind of situation. That was around 9 o'clock. Tell me why these people called me at, why these people put in for a blood gas on that same patient at 1:30 in the morning. And I'm like, so like I say, man, some of this stuff, man, and it's I hate to say it and it's bad to say, but it's the truth. If you want to survive in this field without all this stress on your head, sometimes you got to just follow these orders, get it done, and get out these people's face, man. Just do what's supposed to be done, do what's ordered, complete it, and get out the way. Because if you try to go back and forth, you're just going like, you're fighting a battle that can't be won. So I'm asking the nurse, I'm like, yeah, so who put in for this order? That's like, okay, the nurse practitioner. I'm like, all right. I'm like, do you know, like, what's the reason why? Oh, because I was talking to her and I told her about what happened earlier. But the patient is in bed with a 50% venti mask on, respiratory rate is 16, sleeping like a baby with no respiratory distress, sat 100%. Why would I not draw ABG? Why would I not do that? But like the nurse said, I told her this, I told her what happened. Now, a seasoned nurse would have said, oh yeah, well, earlier we did have a little respiratory issue, but the therapist came through, took care of it. Everything is much better now. The patient is breathing fine, sounding well with no respiratory distress, a normal respiratory rate. You're going to make everything sound good and give it evidence and like supporting details so the nurse practitioner know, like, okay, maybe I don't got to order nothing. But if the nurse was saying, yeah, well, we had earlier she had some respiratory distress, she wasn't really doing too well, the therapist came and gave her a breathing treatment, that kind of helped her out a little bit. You ain't saying stuff that make me like, well, damn, she's doing good. So I got to go ahead and stick somebody. That was a normal ABG. CO2 was 56. That's high. My car was 31. That's fully compensated. It's fully compensated. But like I say, man, I knew that the patient was fine on this, like they're doing fine. Now I'm not gonna say that. It was a time when I drew a blood gas and I ain't say, man, this blood is doing good. This patient is bright red. Everything is cool. And it was bad. That has happened. That's why I ain't gonna say I'm always right. But this one here, I knew I was right, bro. I seen this lady how she is now. I seen it. Hey, man, but I guess that's what comes with the feel. Then I had another situation where a nurse wanted me to put a patient on a BiPAP machine. Like I say, man, I'm cool with that. But if the patient fighting and resisting, bro, I'm not doing it. So I go in there. The patient, finna put the mask on the patient. Anytime I come up to a patient that's kind of like, really any patient, I learned this as a student, I never lean over a patient in bed. Like, never lean over no patient nowhere in bed. Anything I'm handing you, it's my hand that's in front of you. You getting all of this if anything was to go wrong. You ain't getting, my head ain't gonna be in there. Oh, no, you ain't finna, no, not, whatever. You ain't finna headbutt me, you ain't finna headbutt me, you ain't finna burp on me, you ain't finna throw up on me, you ain't finna cough on me, you ain't finna sneeze on me. I'm not finna be in no patient face doing that. That's me personally. That's my, now if you want to be all intimate in a close setting, yeah, now I'm gonna tell you how to take this. You take a deep breath. All right, may the Lord be with you. But me personally, I ain't doing it. When I start having fun with it, I'll be done with it. So I'm going to the patient with the BiPAP mask. Here you go. The patient like, grab the mask and slap it out of my hand. Okay, cool. No means no. Patient combative. I'm scared. Say what you want to say. I'm scared. Yep, Randy's scared of patients. 100% right. I ain't scared of getting hurt by patients. I'm scared of what I may do to a patient. Hey, I'm so happy because, like, today is my day off. I just worked 3 days. I got 1 day off and I gotta work another 3 days. And then my foot, I ain't gonna lie to you. Like, my foot is still like, what I wanna say, it's not painful. It's still discomfort. There's still some discomfort there. But before I left home, I used that Tiger Balm, that ointment for like pain relief and like all. When I tell you, as soon as that ointment touched my skin and my foot, I ain't feel no pain. Well, I ain't feel no discomfort no more. So I'm like, damn. But I know that I don't want to mask the discomfort. I really want to like stretch out that tendon or that ligament that's been like that has the stress on it that's causing the discomfort. So I really want to be aware, like, the shoes I'm wearing. I want to get some sole inserts, and I'm still gonna hoop. I'm still gonna play basketball. So whenever I get done playing basketball, I really gotta like soak my feet in like ice to really take care of my body, because like I'm getting older. I gotta like treat my body differently. This ain't like I'm still 17, 18 playing basketball all day long, day and night, week in, week out with like no problems. I can't do that no more. I'm older, so I just know that I gotta be aware of that. So I'm gonna go home. I'm gonna really go home, stay off my feet. I'm gonna massage it a little bit. And I'm off today, so I'm gonna really just chill. But I wanna go pick up my son early from daycare. I don't know what I'm gonna do with him yet. I wanna take him to the movies. I wanna take him to like get some hibachi dinner. But he wanna go to his grandma's house. All he keeps saying is grandma's house. Like, he loves his grandma, so I may just go pick him up and get him something to eat and take him to his grandma's house. Cause that boy just wanna go to his grandma's house. He loves grandma. Right now I'm finna once I leave the work parking lot, because I'm doing my car talk, I'm in the parking lot. I'm gonna get home early, wake my boy up, get him ready for school, let him brush his teeth. Like, when my son is acting good, when he being good and obedient and he doing what he's supposed to do and saying, yeah, Daddy, I'm a big boy, I'm strong, I brush my own teeth, I'm ready for school, bye, Mommy, I love you. It's a great feeling. Now, when you gotta be like so patient, it's still a great feeling, but it's also like, it's testing your patience though. But I guess that's what comes with it. What else happened today, man? What else happened last night that was like something I gotta tell you? Oh, I came up with I'm gonna do a video called I don't feel comfortable doing, stemming from that event that took place last week. And I was like, I don't feel comfortable doing something, I'm not gonna do it. And that's gonna be an at-home sit-down video, and I'm gonna just go through a whole list of things that I don't feel comfortable doing and that I'm not gonna do as a respiratory therapist. Point blank, period. And whatever happened that come with that, it comes with it, bro. I'm not finna do it, so I ain't gonna give you no hints right now. But I got one thing written down, and I know a whole bunch more things, man. I just gotta write them down. And I'm gonna take care of that. Besides that, what else? I had to go to a rapid response. Like I said, I was drug overdose. I had to get a patient Narcan. Everything was cool. Had to run a blood gas from that patient. The blood gas was normal. It wasn't a respiratory therapy issue. But when somebody is knocked out and they in bed, you want to double check, make sure everything good, because they ain't breathing the best. But it's because they was giving too many damn drugs. If you give any person too much drugs to put them to sleep or calm them down, bro, I'm gonna be out of there. Like, you finna OD me. What else, man? Yeah, for the most part, like, my night was good. I had a lot of downtime. I didn't start my work early, but I still finished around 10 o'clock. I think 10 o'clock may be that just may be my time, my finishing time. I started around like 7:40, and I finished around 10 for my first round. I had 2 treatments for my second round. And the rounds go every 4 hours is a round. So you have a round from, you got 8 o'clock treatments due, you got 10 o'clock treatments due. After the 8 o'clock treatments are due, you got 12 o'clock treatments due. Then you got 4 o'clock treatments due. So that's round 1, 2, 3. You feel me? That's my 3 rounds. So first round, that was when I had the 19. Second round, I had like 2. And then the third round, I had 10. And then for the third round, which is 4 o'clock in the morning, a lot of patients don't want to be waking up. So that kind of puts you down as well. And I think, for the most part, another thing I want to touch on, the last thing I'm going to touch on, like time and getting old and all that. I keep touching on that subject. I keep talking about that. And I'm realizing it because I remember working at this facility as a teenager. I wasn't always a respiratory therapist. I used to transport patients throughout the hospital. I was a transporter. And I remember seeing people that I'm seeing now. They got a full head of gray hair. And I remember seeing them, they had a full head of black hair, jet black. Now my hair getting some grays in it. You feel me? Like, time is going, like, bro, it's going. I just told my homegirl this morning. We graduated the program from the same class, from the same year, we was in the same program. I'm like, yeah, man, 2015, we still 2015. They're like, damn, that's 9 years. That's going on 10 years. But that's going on 10 years since I've been a therapist. It's going on 10 years. I never imagined that when I was in the field, when I was just in the class, studying, doing my prerequisites, doing my internships, that, bro, 10 years in? So I've been here 10 years. When I came in, y'all had been doing it for 14, 15 years. And now y'all, so that's 25 years. Bro. Another thing I want to touch on, one last thing. Now that's going to be a video idea. You gotta, for my therapist that's coming into the field, my new therapist that's just in it 1 year in, 2 year in, and all the students that's gonna go into the field, gonna come into the field and get their money and get all the stuff they want to get. I suggest you have 3 things, like 3 dream items, 3 things that you want to do on your bucket list. Mine was getting a house, Mercedes-Benz, Rolex watch, sit courtside of the NBA basketball game. Really these 3, but you can add 4. Now these 4 things may change. You may say, like I say, forget the Rolex watch. Now I want to put a Corvette there. So it's going to be Mercedes-Benz, Corvette, home, sit courtside. When you have these 4 things, you can like conquer these things. And once you conquer them, you can kind of be at peace. Because like when you have these desires and these wants, until you get it, it's going to like just like continue to like motivate you and like eat at you. So you got to fulfill those desires. And as long as there ain't nothing crazy, I ain't talking about hurting nobody, doing no wild, freaky, I ain't talking nothing, no Diddy freak offs. I ain't talking nothing crazy. I'm just saying, like, these desires that you want, these things that you want to attain, these materialistic items that you want to attain, like, or from traveling, I want to go to Paris. I want to spend 2 weeks in Hong Kong. Like, just put them on there so when you accomplish them, you know, okay. Bye-bye. Now, don't put this down and pop up something else because you're going to never be at ease. Your mind going to sit around a mile a minute trying to get this stuff. And that was just like, I was going to touch on that, man, because let me know if y'all want me to make a more detailed video about that, because I really can touch on it a whole lot more. But to sum it all up, you want to make it 3 or 4 simple things, not simple things, 3 or 4 items that you can just get. You accomplish those goals. Now you can just go and live and just be a regular human, or be the best human that you can be to your best abilities. Because like, if we keep chasing this stuff, keep chasing this, bro, you'll never be at ease, bro. Like, you'll never be at ease. And then I saw somebody say about my because my foot been hurting. They was like, yeah, you probably have plantar fasciitis, some with your foot, man. But it could be a number of things. It's like a number of things I seen, like the name of it. But it's all comes from, like, some people say, yeah, that's what comes with the field. Because I stand on my feet a lot, and I agree. But that wasn't when the discomfort started. I didn't just start like I had a long work night and now my feet hurt. No, I got done playing basketball, my foot was hurting. I went back and played basketball, my foot was hurting. I never let it chill. I know mine come from like too much shock on those on the ball of my foot, too much shock from just playing basketball. Because how I play is, I'm gonna give a quick little basketball lesson. I do the triple threat move, and I do that jab step with that foot. I jab with that foot and I go. That's my whole game is bam. That's what I'm quick with it. So, hey, y'all be easy, man. I'll be out here all day. I gotta get home with some baby boy.